Today we speak to experts in Korea and the UK. We're seeing a wave of panic across the world, with people emptying supermarket shelves, queuing outside pharmacies, and generally just worried about leaving the house in case of contracting the coronavirus. It's understandable that the pandemic is causing stress, but for some of us, it's becoming all too much. To discuss how we can handle panic and fear as a society and on an individual level, we connect with Robert Dingwall, a sociologist and professor of social sciences at Nottingham Trent University. We also have Suh Sooyeon, professor of psychology at Sungshin Women's University in Seoul. Let's start with you, Dr. Dingwall. The level of panic and the intensity of it that we're seeing across societies seems to be on quite a different level when compared to the SARS and MERS outbreaks that we saw in the past. What is the reason for that?
Well, I think with both SARS and MERS, they were relatively limited in their geographical spread. So you didn't have this same sense of a world out of control or a global order that was threatened by this random force, the random emergence of these new viruses. And I think that's something that people have found particularly difficult to deal with. SARS was much more serious, but was as a result of that, it was much easier to contain. MERS has never really spread very far from its origins in the Middle East, although it's quite a serious disease if you happen to get it.
Well, do you think social media might have anything to do with it? We're seeing all these scary stories and even junk science, this fake news as well on social media, and we're exposed to it all the time.
Well, social media is certainly a challenge to governments by presenting all of these alternative and sometimes very bizarre accounts of reality. It's really hard for accurate information to get through, and it's constantly threatening to undermine the trust in the goodwill of governments, confidence in the actions that governments are taking, because there's always some voice out there that is claiming that it could be done differently, or that there's some hidden motive, or that people are behaving in a corrupt or irresponsible fashion. No government wants to actively damage its citizens. It's one of the fundamental roles of government is protecting the lives of its people, and no government knowingly sets out to do something different.
Right, and this deluge of information that we're getting, it's really adding, it's fueling our emotions really, and people really are fearing for themselves and their loved ones too, especially if they've been directly impacted by the virus or whether they're in quarantine. But for some of us, it's becoming all too much. So Dr. Suh, what are some signs that you might be overly stressed by this pandemic, and what could be the consequences?
It's an understatement to say that our lives have changed dramatically since the quarantine from the coronavirus. However, if you are seeing a serious change in your mood, or you're feeling hopeless, you're having thoughts about wanting to hurt yourself or other people, it'll be very important to seek help with a mental health professional. And especially in times of uncertainty, it's really important to manage your stress, because it could trigger the onset of psychiatric illness, especially if you have a history of mental health issues.
That is very concerning indeed. Especially if you're vulnerable emotionally anyway, then the stress of this whole pandemic is very likely to get to you, isn't it? And well, on a society-wide scale, Dr. Dingwall, what are the social or societal consequences of people in general panicking and reacting in fear?
Well, I think one's got to be careful about using words like panic. They get used in common sense much more easily than they're used by social scientists. By and large, what we're seeing is rational responses to a very irrational situation. As a friend of mine put it, panic buying is really just looting by people who've got money, and it ends up excluding a lot of the most vulnerable people from access to the supplies on which they depend. But I think it also, if you like, reveals the importance of trust and cooperation in the maintenance of order in the society. That you can't just, as it were, make people behave. If you encourage a very competitive environment in a society, then at times of stress like this, you do get the sort of selfish behaviour that people are very quick to denounce. And that is a challenge to political leaders who, for the last 30 or 40 years, have been promoting this idea of a very laissez-faire society, of a very small state, of every citizen just depending upon themselves rather than on their relationship with others. Now we're in a time where those relationships are really critical, and that sort of social capital has been run down, and it's not something you can rebuild quickly.
Right, a threat to social capital. But then with this virus, authorities are advising us to stay home, social distance ourselves, and self-quarantine if we feel that we may be posing a health risk to others. And of course, in countries like Italy and Germany, whole cities have been shut down. But being isolated at home, we are constantly exposed to rather depressing news stories and news feeds, texts from our neighbours. Well, Dr. Suh, how can we stop ourselves from becoming overwhelmed by this and becoming too stressed?
There's a couple of things that people can do. For example, having a daily routine and maintaining structure to our day is very important. It's very easy to lose structure to your day by sleeping in or sleeping late in the evening, eating and working at odd hours. And research in psychology shows that having some type of regular rhythm, such as sleeping, eating, getting outdoor activity is essential to maintaining good mental health. So even though you don't have to go to work, even though you don't have to get up at a certain time, still maintaining that structure is important. Some other things that you could try to do is scheduling activities to help boost your mood. Psychology research shows that doing activities that bring either pleasure or giving a sense of accomplishment helps really boost your mood. So scheduling something ahead of time, for example, something that makes you feel good or something that is productive, at least scheduling one of these activities once a day will be helpful. And finally, limiting exposure to news. It could be very overwhelming to actually be exposed to a lot of news that is scary, and it can make you spiral out of control. So having information is good, but limiting yourself to a few pieces of updates a day from reliable news sources will probably be helpful.
Right, learning how to tune off at times, and also maybe scheduling in one or two activities that we could do regularly that could really help us. Well, Dr. Dingwall.
I really think we shouldn't underestimate how difficult this is. There is a very good reason why we're reluctant to put prisoners in solitary confinement. And, this sort of, we've got to be very careful not to turn self-isolation into self-imprisonment. There's a very good research, and I'm sure my colleague knows this from the experience of people who self-isolated during SARS, about how mental health problems can set in very quickly with the sort of extreme degree of isolation that some governments are asking citizens to undertake. And I really don't think that's sustainable for any great length of time.
Well, and I absolutely agree. Social distancing shouldn't be the same as social isolation. It's important to stay emotionally connected to people, even though it's not necessarily face-to-face. Scheduling FaceTime calls to your friends, checking in to see how they're doing, making sure that you realize and accept that this is a very difficult situation, and normalizing the experience is very important. Getting a lot of support from people that you know.
Emotional support is vital, I think, and people who live in multi-generational families, which members of the family should we really support as well, like young children or the elderly? Should we be approaching them, or should we be supporting them in different ways?
Well, I think they need different kinds of support. Obviously, there's a need to talk to children in language that they can understand about the difficult situation, especially if you're having to explain to them why they can't go out to the playground or why their school's closed. There's also obviously a conversation to be had with an older generation. But I've really been very concerned by some of the stories that I'm picking up about people in midlife bullying their parents who are perhaps choosing not to isolate themselves as rigorously as their children might wish. And I think some of this is about a middle generation that hasn't really come to terms with the prospect that we all die eventually. Nobody wants to die before their time, but for seniors, I think it's a quite different matter, and we should be careful not to be too paternalistic. I have certainly told my children that if they start giving me lectures, I shall leave them out of my will. But I am very just concerned about this attitude of, as it were, people in their 40s and 50s, who are trying to give lectures to their parents in their 80s and 90s. And I think we have to respect the autonomy of the old, where they have the cognitive capacity to do that.
We do react very emotionally to these situations, and especially when we're hearing all this bad news all the time on social media, on the news, on the radio, text messages. But Dr. Suh, then how should people really handle bad news and even grief and actually give more support to those around them?
That's a very good question. If you have tested positive for the virus, it can be very traumatic at first. If you think about how people react to a serious diagnosis such as cancer, people can immediately jump to catastrophic thoughts such as, I'm going to die. And while it is a very grave situation, research shows that being overly stressed initially from the diagnosis can actually affect immune system functioning and actually get in the way of recovery. So it is important to manage your stress. And, if it's difficult, talking to a mental health professional if you're really struggling. The same thing goes for if you've experienced a loss. Situations like this can cause sudden losses and can make it very difficult to accept the situation. And in times like these, I know at least for the case of Korea, most psychiatry hospitals are open, and so are psychological clinics, and there are options of telehealth medicine. So, if you're feeling that you're having a lot of difficulty, I would definitely advise to talk to a professional.
Well, that's all we have time for today, I'm afraid. But as Dr. Suh just said, if you are feeling overly emotional or you feel that you can't cope with things at the moment, then South Korea, if you're in South Korea, it has a national helpline, that's 1339. If you're watching from abroad, do contact your national healthcare provider as well for support. Well, thank you very much, Dr. Robert Dingwall from the University of Nottingham Trent and Dr. Suh Sooyeon from Sungshin University in Seoul.
Thank you.
Yeah.
This is also where we wrap up our show today. We're going to be back on Monday, Korea time, with more global insights on issues making headlines. Until then, have a lovely weekend wherever you are. Bye-bye.